It is held in a modified hand grasp. It is usually used in push, pull or pry motion. Straight elevator. It is held in palm and thumb grasp with a pointing forefinger. It is usually used in lever and fulcrum principle. Coulan's elevator. It is held in palm and thumb grasp. Primarily used as wedge principle. Apxo elevator. It is a paired instrument. It is held in palm and thumb grasp. It is used for removal of fractured root tips or apices. It is primarily used as wedge principle. Crier's elevator. It is a paired instrument. It is held in palm and thumb grasp. Primarily used as wheel and axle principle. It is used for extraction of maxillary teeth. It is useful when one of the roots have been removed. The elevator is used through the socket of that root to remove other roots. Crossbar elevator. Also known as Winter's crossbar. It is a paired instrument. If one is used as distal on right side, it can be used as mesial on left side and vice versa. It is held in palm and thumb grasp. Primarily used as wheel and axle principle. It is used for extraction of mandibular teeth. It is useful when one of the roots have been removed. The elevator is used through the socket of that root to remove other roots. Warwick James elevator. Paired instrument for right and left side. Curved and straight varieties are available. It is usually used for third molar extraction. Elevator's revision. Perio STEAL elevator. Straight elevator. Coulan's elevator. Apxo elevators. Crier's elevators. Crossbar elevators. Warwick James elevators. Extraction forceps. An extraction forceps consists of 3 parts: beak, hinge, and handle. Forceps grasp. Maxillary forceps are held in a palm-up grasp. Mandibular forceps are held in a palm-down grasp. One must remember the forceps should always engage the root of the tooth to be removed, not the crown. They should adapt well to the surface of the root, or at least have a 2-point contact between the forceps beak and the root. One should be careful not to crush their finger when using a forceps. Maxillary forceps. Maxillary anterior forceps. It is used for the extraction of maxillary anterior teeth. This forceps is completely straight. Maxillary premolar forceps. It is used for the extraction of maxillary premolars. It is slightly curved. It is held so that the concave part of the handle rests on the palm. Maxillary molar forceps. It is used for maxillary molars. It is a paired instrument, one for a left and one for right side. It has a pointed end on one beak which engages the buccal furcation area. This determines the side of the forceps. The other beak is smooth and slightly curved to engage the palatal root. Maxillary cowhorn forceps. It is used for maxillary molars. It is a paired instrument, one for a left and one for right side. It is especially used for extraction of grossly decayed teeth, which cannot be gripped by maxillary molar forceps. There is a single conical beak which engages the buccal furcation area. This determines the side of the forceps. The other beak has two prongs which engage the palatal root. Maxillary third molar forceps. It is designed keeping in mind that maxillary third molars often have fused and bulbous roots. The beaks are rounded. The handle is sharply bent to facilitate better reach. Maxillary root forceps or bayonet forceps. It is used for extraction of root stumps. The beaks are tapered and tips meet to get better grip over root stumps. Mandibular forceps. Mandibular anterior forceps. It is used for the extraction of mandibular anterior teeth and sometimes for root stumps. In this forceps the beaks are smooth and come in contact. Mandibular premolar forceps. It is used for the extraction of mandibular premolars. It is much similar to anterior forceps, but beaks do not come in contact. Mandibular molar forceps. It is used for the extraction of mandibular molars. In this both the beaks have a sharp projection which engages the furcation area. Unlike the maxillary counterpart, this is a single instrument, which can be used for both sides. Mandibular cowhorn forceps. It is also a single instrument for both sides. It is used in case of grossly decayed teeth. Forceps revision. Maxillary forceps. Anterior forceps. Premolar forceps. Molar forceps. Cow horn forceps. Third molar forceps. Bayonet or root forceps. Mandibular forceps. Anterior forceps. Premolar forceps. Molar forceps. Cow horn forceps. We have to properly support the jaws and alveolus during the extraction procedure. For this we use a tripod support using 3 fingers. Support for maxillary teeth. Support for mandibular teeth. Patient chair positions for standing extractions. For maxillary teeth extractions, the chair should be raised so that the patient's head is slightly below the operator's shoulder. Chair should also be slightly reclined so that the patient's maxilla is 45 degrees to the floor. For mandibular teeth extractions, the chair should be lowered such that the patient's head is slightly below the operator's elbow. Chair should also be kept upright so that the patient's mandible is parallel to the floor. Operator positions. For the extraction of teeth in the lower right or the 4th quadrant, the operator stand behind the patient at 11 o'clock position. For extraction of teeth in all the other quadrants, the operator stands in front of the patient. Accessory instruments. After extraction of a teeth, some accessory procedures may be necessary to ensure proper post-operative healing of the extraction area. Barred Parker handle or BP handle and barred Parker blade or BP blade is used for placing incisions. In minor oral surgery, usually number 11, 12 or 15 blades are used. Curette is a double-sided instrument. It is used for removing any periapical pathologies like cysts or granulomas. Bone file. It is a double-sided instrument. One side has a flat end and the other side has a curved surface. There are surface serrations which point backwards. It is used to smoothen any sharp bony projections after extraction. It is also used during alveoloplasty procedures. Rounger. It is used for removing larger or harder sharp bony projections. It comes as side cutting and end cutting variants. Used during extractions and alveoloplasties. Tissue holding forceps. It is used to grasp tissue during minor oral surgeries and suturing. It comes in 2 variants. Tooth tissue holding forceps. Non-tooth tissue holding forceps. Used for holding delicate tissues. Suturing instruments. Consists of needle holder and scissor. Needle holder is identified by crisscross striations on the inside. It is a latched instrument. It is held with thumb and ring finger, with middle finger.
By seeing the beaks. So if the beak is at right angle to the handle, that means it is a lower forceps. Now how do you find out which instrument we are going to use for extraction of which teeth? So for this we are going to see the beak.
Maxillary root forceps or bayonet forceps.
You find that there is little distance between the beak when they are closed. And when you see this instrument right here, you find that the distance is little more.
The beaks are tapered and tips
And
meet
then
to
here
get
we
better
have a
grip
little
over
more
root
distance.
stumps.
So when we see this instrument, we find that they look pretty similar. So these are the molar forceps. So this instrument is used for the
Mandibular
extraction of
forceps.
central incisor and
Mandibular
lateral
anterior
incisor, and this
forceps.
one is for the
It
premolars
is
because the
used for
distance
the
between the beak
extraction
is
of
a little
mandibular
more.
anterior
And
teeth
these
and
two, these are
sometimes
the
for
molar
root
forceps. So
stumps.
you can have a
In this
question, why do we
forceps,
have
the
two
beaks are
forceps?
smooth and come in
Actually,
contact.
this is due to the anatomy of the root of the maxillary molars. We have 3 roots, 2 buccal root, the mesobuccal and the distobuccal, and 1 palatal root in the maxillary first molar. So you can see this beak here. You
Mandibular
find
premolar forceps.
that we have a
It
little
is used for the extraction of
prominence,
mandibular
or you can say
premolars.
the beak here, and the
It is
other
much
surface
similar
is
to
kind of
anterior forceps,
smooth.
but beaks
so
do
this
not
beak,
come in
it
contact.
goes and engages in between the 2 buccal root, okay, and this one will go to the palatal root. So this is how we hold the instrument,
Mandibular molar
and we keep our
forceps.
thumb here. So you
It
can
is
see
used
that
for the extraction
beak
of mandibular
is towards this
molars.
side.
In
So
this
when you
both the
apply
beaks
it
have a
on the
sharp
patient,
projection which engages the fur
this will
cation
be
area.
towards the buccal side.
Unlike the
So this is
maxillary
the
counterpart, this is a
second
single
quadrant, or you can
instrument
say the
which
left
can be used for both
molar
sides.
extraction for the patient, left of the patient, right? And when you hold this one, you can see the beak is on this side. So this is for the first quadrant, or the right molar extraction, the patient. And now these are the cow
Mandibular
horns.
cow horn
So
forceps.
the shape of the
It
cow
is
horns.
also a single instrument for
see
both
The
sides.
same thing applies here also. We
It
have
is
2 beaks
used in
here,
case of
and that
grossly
will
decayed teeth.
go to the palatal side, and this one will go and engage in between the 2 buccal root. So if we hold the instrument like this and keep our thumb here, and we find that this will go to the buccal side.
Forceps revision.
This is the second
Maxillary
quadrant,
forceps. Anterior forceps.
When we hold the instrument,
Premolar forceps.
this instrument,
Molar
this is going
forceps.
to be the first quadrant. Alright?
Cow horn
Now when we
forceps.
come to this side, we find this
Third molar
instrument, this is
forceps.
the bayonet. You
Bayonet
can see
or root forceps.
a typical shape it's having. So it is
Mandibular
called the bayonet
forceps.
because
Anterior
it resembles
forceps.
the gun which we used in
Premolar
the
forceps.
World War II, I think.
Molar
Somebody
forceps.
told me. Okay.
Cow horn forceps.
So this is the bayonet,
We have
and
to
it's
properly
used for
support
the
the
root
jaws and
extraction.
alveolus during
so when
the
you have used
extraction
the root
procedure.
lift, we use this because you
For
can
this
see
we
it is really
use the tripod
pointed,
support using 3 fingers.
and it will help
Support for
give us
maxillary teeth.
that.
Support for mandibular
And
teeth.
then this one, this is the third
Patient
molar
chair
forceps.
positions for standing
You can see it
extractions.
is also having a typical
For
shape.
maxillary
So
teeth
it has a
extractions,
very
the chair should
long,
be raised so that
a
the
beak.
patient's head
This
is
the
slightly
hinge, and you can
below
see
the
it's very
operator's
long.
shoulder.
So the reason for
Chair
this
should
is
also
because
be slightly
we need
reclined so that
access, right?
the patient's
vision
maxilla
because
is 45
Our
degrees to
instrument
the
should
floor.
reach the third molar.
For
because it's very
mandibular
far
teeth
away.
extractions,
So
the
to
chair
get
should be
that
lowered such
reach,
that
we have such a
the
kind
patient's
of design.
head is slightly below the operator's
Now
elbow.
we can review it again.
Chair should also
This
be
is the
kept upright so that
incisor,
the patient's
forceps,
mandible
upper
is parallel
incisors,
to the floor.
and this is the premolar. These
Operator
two were the
positions.
molars. And
For
these
the
were
extraction
cow
of
horns,
teeth in the lower
okay,
right or the
which are
fourth
used for
quadrant,
grossly decayed teeth.
the operator stands
Because they
behind
engage
the
frontation
patient at
area.
11
So
o'clock
when you have
position
grossly decayed teeth, only
for extraction of
probably
teeth
the
in all
frontation
the
area
other
is left
quadrants.
intact. That's right.
The
And then
operator
this is the
stands in
bayonet,
front of the
and this
patient.
is the third molar
Accessory
forceps.
instruments. After extraction of a teeth, some
Now let's
accessory
talk about these
procedures may be
instruments. So
necessary
this
to ensure proper
identification
post-operative
will be
healing of the
possible by
extraction
beak as
area.
well. So you find
Barred
I don't have
Parker
actually
handle
all
or
the
BP
instruments
handle
with me. So
and
this is
barred Parker
actually
blade or BP
the
blade
incisor
is used
and
for
this is
placing
the molar
incisions.
one. So you can see in the molar
In
one we
minor
have
oral
beaks
surgery,
on both
usually
sides.
number
Because
11,
the
12 or
first molar
15
has
blades are
2
used.
roots, the mesial and distal.
Here at
So it will go and
is a
engage
double-sided instrument.
on both the sides.
It is
This the
used
molar.
for
I
removing
think
any
the premolar one
periapical
is missing here.
pathologies like cysts or granulomas.
And then this is the cow horn. also used for the grossly decayed teeth. The cow horn, you can see it looks like the horns of a cow, or
Bone
parrot
file.
teeth. And
It
then
is a
this one is
double-sided
third molar
instrument.
forceps, and you can
One
see this is
side
also
has a
having
flat
a
end
typical
and the
shape.
other side has a curved surface.
So
There are surface
this is the
serrations
third
which
molar
point
forceps.
backwards.
Alright, now we'll
It
see
is
how
used to smooth hand
actually
any
apply this
sharp bony
forceps
projections after
on
extraction.
the typhoidome.
It is also used during alveoloplasty
the
procedures.
premolar forceps as well. So here you can see the
Rounder.
difference between the
It is used
incisor
for
forceps
removing
and the
larger
premolar
or
forceps.
harder sharp bony
You can make
projections.
out the differences in the
It comes as
opening of the
side
beaks.
cutting and end
So
cutting
in this you
variants.
can see that
Used during extractions
there is
and
minimal
alveoloplasties.
opening in the beak, and here we have a little more opening for the beak. This is how we
Tissue
identify
holding forceps.
the
It
forceps.
is used to grasp tissue during minor oral
Now
surgeries and
one tricky thing to avoid
suturing.
confusion. We saw
It
that
comes in
we
two
have
variants.
two molar forceps,
Tooth
the
tissue
right and the
holding
left
forceps.
for the upper, and we have a single forceps for the lower one. Okay, so if you see this instrument right here,
Non-tooth tissue holding
this is a molar
forceps.
forceps, and let me
Used
just-
for
so
holding
the beak is
delicate
right here.
tissues.
That means and this will be on the
Suturing
buccal
instruments.
side, engaging.
Now, how do you find
between
out
the
which
two
instrument
buccals?
Consists of
we are
needle
going to
So you're holding
holder
it
and
this way.
scissor.
section of which
This
teeth?
will be for
So,
the
for this we are
second
going to see
quadrant
the beak.
or the left
When
molar
you see the beak here,
for the patient.
you find that there is
What
little
if you hold the
distance
Needle
instrument like
holder
this?
is
When you
identified
use
by
the
crisscross
first quadrant.
striations
When
you
on
see
the
this
inside.
instrument right here, you find that the distance
So
is
for
It is a
that,
left
we
instrument.
see
and then
this
here we have a little more
convexity and
distance.
concavity
So
thing.
when we see this
So this
instrument,
is the
we find that they
upper
look
surface.
pretty similar.
This is the convexity,
So these are the molar
and this is the
forceps.
concavity. So we hold the instrument in such a way that the convexity is
so
towards
this
the
instrument is used for
upper
the
side,
extraction of
and the
central
concavity
incisor
rests
and the
on our
lateral
palm.
incisor,
So this is
and
how
this
we
one
hold
is
the
for the
instrument, and
premolars
this is
because the distance
how
between the beak is
we
little
get a
more.
better grip and
And
better
these
comfort
two,
while
these are the
holding the
molar
instrument.
forceps. So you
So
can
just keep that
have
in
a
mind.
question, why do we have two forceps? Actually,
Now let's
this is
imagine a
due
patient
to the
comes to you
anatomy
and
of
he
the
wants to get his
roots of the
lateral incisor
maxillary molars.
extracted.
We have
So how are we going to
three roots,
proceed? First of all, we'll
two
choose an instrument of
buccal
our
roots, the
choice,
mesobuccal and the distal
and
buccal,
that would be
and
this
one
instrument
parietal root
right
in
here,
the maxillary
based on the
first
beaks.
molar.
And then
You can see
what we're gonna do,
this
we'll hold it
beak
like
here.
this. I'm a
You
left-hander,
find
so
that
I'm
we
holding
have
it in
a
my left
little
hand. Okay. And
prominence,
this little
or you
finger
can say the
will
beak
be
here,
used
and
to
the
open
other
and close the
surface is kind
instrument,
of
and then when
smooth.
we are done,
So
we'll
this
just
beak,
hold it this way.
goes
And the thumb will lie here.
engages in between the
Alright. So
two
now my
buccal
beak is
root,
open,
okay,
and
this
I'll go
one will go to the palatal root.
that way. I don't have an assistant.
So this is how
And
we
we'll
hold
hold
the
it
instrument
as far as possible
and we
into the
keep our thumb
furcation.
here. So
Or
you
you
can
can
see
say apically.
that the
And
beak
first force is
is
given
towards
apical,
this side.
and then buccal,
So when
lingual,
you apply it
rotation,
on the
and take it
patient,
out. Oh my god. I extracted
this
it.
will be towards the buccal side. So
Alright.
this is the
Now,
second
for
quadrant,
example,
or you can
if
say
you
the
want
left
to do
molar
extraction
for the patient, left of the patient, right?
of the premolar,
And when you
we'll
hold
be
this
using
one,
this one. Okay.
you can see the beak
And
is
this
on
is
this
the
side.
molar one.
So this is
You can
for the
see
first quadrant
the beaks
or the
here.
right
It has
molar
beak one
extraction
side and
of
a
the
flat
patient.
surface one side. So
And
this
now
beak
these
always
are
goes
the
to the
cow
buccal
horns.
side. So this is
So
going to be the
shape
left
of the
of the
cow
patient,
horns,
right?
you
It
can
will
see
go like this.
the same thing applies
Okay,
here
hold
also. We have two
Give the
beaks
apical
here,
pressure,
and that will
buccal, lingual, and take it out. This time I won't extract it
go
all.
to the palatal side,
And then
and this
you
one
can
will
see
go
this one
and
right
engage
here.
in between
This is also a
the
molar
two buccal
forceps,
root.
but the beak
So
is on
we
the
hold
opposite
instrument
side.
like this,
So what we're gonna do?
and keep our thumb
You can
here,
hold the instrument,
and we find that
do it, then
this
slide.
will go to the buccal side. So this is the
Okay,
second
give the apical
quadrant,
pressure.
alright? And
buckle,
when you
lingual,
hold
and take it out
instrument-
buccally. Alright?
this instrument.
Now this is the
going to
cow
be
horn.
first quadrant.
So the cow
Alright.
horn,
Now when we come to this side,
you can
find
see
this
the typical
instrument,
shape
this is
of
the
a cow horn.
bayonet. You can see
This will go
a typical
in between
shape
the
it's having.
buccal
That is
roots,
called the
and
bayonet because
this will go palatally.
it resembles the
Hold the
gun
instrument
which
this
we
way.
use in the
Use
World
your
War
little
II, I
finger,
think.
open and close,
Somebody told me.
and then
Okay.
just
So
grab
this is the
the
bayonet
case stud
and it's
from the
used for
furcation,
the root
and then
extraction.
take it out.
So when you have just
Alright.
the root left, we use this.
And this is the
See,
bayonet,
very
which is used for the
pointed.
extraction of roots, and this is
it
the
will help
typical third
achieve
molar forceps.
that.
So use it for the extraction.
And then this one,
This teeth,
this is the
alright.
third molar forceps.
Oh, I like it.
So you can see it is also having
Now
a
let's say
typical
the
shape.
patient wants
So
extraction of his
it has
lower
a very
teeth. So,
long,
this is
a
our
beak.
forceps.
This is the
We
head.
can
and you
apply
can
it
see It's very long.
on the tooth like
The
this.
reason for
The
this
first
is
pressure will be a
because
pical,
we need
and then
axis.
buckle,
Right?
thing will rotate and
vision
will
because
come out.
our instrument should reach.
And
the
this is the
third
molar
molar
one.
because it's
You
very
can
far
see
away.
it has
So to
two
get that reach,
beaks on both
we have
sides.
such a kind
So
of design.
this will be applied
Now we can review
this
it
way.
again.
It
This
is
is
ready
the
to go. And
incisor.
give vital pressure,
forceps,
buckle lingual,
upper
yes,
incisors.
buckle more and take it
And
out.
this is the premolar. These two were
Come
the
on, ma'am.
molars. And these were the
Uh-huh.
cow horns,
Come on.
which are used for the grossly decayed teeth
निकाल के छोड़ोगे क्या?
because they engage the furcation area. So when you have grossly decayed teeth, only
This is the cow
probably
horn.
the
You can
furcation
see
area
once
is left
again.
intact. That's why.
Okay.
And then this is the bunate, and this is the third molar forceps.
And this is the third molar forceps.
Now let's talk about
Of the
these
lower.
instruments. So this
So you can see the beaks, the position of the beaks.
identification
So
will
we
be
apply the
possible
third
by
molar
beak as
forceps.
well. So you find
This
I don't
way,
have actually
okay?
all the instruments with me.
So when you have
So
to
this
apply
is
the third
actually
molar forceps,
the
let's say
incisor,
here,
and
what
this
we're gonna
is
do,
the molar one. So you can see
we-
the molar
you
one.
can
we
see the
have
beaks
the
here.
beaks on both sides.
this is the beak.
because
So this is
first molar
applied
has
this way.
two roots, the mesial and distal.
This is how you apply.
So it will go and
For the other
engage
ones, we're applying
on both
this
the
way.
sides. So this is the
Right?
molar. I think the premolar
But
one
for
is
this,
missing here.
we're gonna apply this way because based on the beaks it's having.
And then this is the cow horn.
Obviously, you
It's
cannot
also used for the
do it like
grossly
this
decayed
because the
teeth.
cheek of the
cow
patient
horn, you
cannot
can see it
retract
looks
it
like
that
the
much
horns
because it's
of a
third
cow.
molar, obviously.
Or
So this is how we do it.
And then this one is third
Now,
molar forceps.
How do you
And you can
hold
see this is also having
the
a
arch of the
typical shape.
patient while extraction? So it's
So-
mandatory to hold the arch.
This is the third molar
Because
forceps.
we
Alright?
have to
Now
avoid
we'll
the fracture.
see how to
So if you are
actually apply
working
this forceps on
on
the typhoid.
tighten it up.
Okay, so I got the premolar forceps.
So if you're working on
so here
this
you
side,
can see the difference
we'll
between
keep the
incisor forceps
index and the middle finger
premolar
this way,
forceps.
and
You can make
this
out
thumb will hold
the
the mandible,
differences in the
and then
opening
we'll do
of
our
the beaks.
procedure, right?
So in this you
Same
can
for this
see
way. You can
that
see this is how you
there
hold
is
it.
minimal opening
Okay. For the
in the beak.
anterior, this is how you hold it.
And here
So this
we
is
have
the
a little
non-working
more
hand.
opening
For me, this
to
is
the
my
beak.
working hand because I'm
This is
left-handed.
how
I'm lefty,
identify
so
the
it will be
forceps.
reverse for me. And
now
for
one tricky
this,
thing to avoid
you hold it
confusion. We saw
this
that
way,
we have two
this
molar
way,
forceps,
okay?
the right and the left
and
for the
we
upper,
don't have the teeth
and
here.
we have a
We
single
place the teeth here.
forceps for the lower one. Okay,
And
so
this way.
if you see this instrument
So
right
this
here,
is done to avoid fractures and to avoid
so
the
the
patient
beak is
getting
at right
hurt.
angle to the
So
handle.
if the instrument
that
slips,
means
it will
is a lower
hurt
forceps.
you and not the patient.
Now, how do you
Alright.
find out which instrument we are going to
So
use for
this was
extraction of
a
which
general
teeth?
idea about
So
how to
for
use the
this we are going
instrument
to see the beak.
and how to
So when you
identify
see
the
beak here,
instrument.
you find that there is little
So
distance
I know the video was a
between
little
the beak when
shaky,
they are close,
not as presentable
and when you see this
as it
instrument right
should
here,
be,
you find that
but I hope
the
you got the
distance
point.
is little more. And then
And I'll try
here
to
we
record
have a
it
little
with
more
my assistant
distance.
next time.
So when we see this instrument, we
Thanks for
find that
watching.
they look
Allah
pretty
Hafiz. If you like the
similar.
video, please don't
So
forget
these
to
are the
share,
molar
comment,
forceps.